they come in from massage school and they always think I'm working where my hands are. Whereas I do a lot of things where I'm grabbing limbs, either arms or legs, to traction, pull, turn, cajole, open different areas of the body. So sometimes they have low back pain, and this is me. Instead of having the person lay down face first on a table and you put pressure, in their back, I go, hey, they're completely clothed, and I go, lay down on your back. And they're like, yeah, man, I just told you my low back hurts. And I go, I know, I have 20 years in pain management. Just give me 5 minutes.
Right.
You're having problems with your low back, and especially it's just like a big, broad, kind of diffuse. It's not specific. I'll grab a leg and then pull the leg up and over to like kind of twist them to one side. And as I pull them over, I go, hey, do you feel that in your low back? In other words, if I'm just holding the leg, they see this on camera, the students, and they go, I don't understand why he's working on their leg.
Mm-hmm.
And I'm like, I'm not working on their leg. I'm using the leg as a handle to reach down into the pelvis and the low back.
Right.
What I have to do is connect that to what the client feels. And when I pull them to one side and there's no real response, I'll get the other leg, go to the other side, and they go, oh. And I go, what is that right there? And they're like, that's that spot in my low back. And I go, Is that feel like it's helping? And they're like, yeah. And then the process of communication and connection and working out their specific itch is like, hey, Leah, right there? Thank you so much. But it took a little bit of changing the client's perception of the service itself.
Yeah.
Like when I worked in a chiropractor's office, which is really where my practice started to take off, because I had to figure out how to communicate with them. As an artist, all massage therapists, as an artist, depending on where we want to go, I don't expect their painting to look like mine. My physical structure, technique, manual, muscle strength, flexibility, wrist structure is all different. I'm trying to get them to be their own artists, which includes their emotional set, psychological set, how they relate to people. I'm encouraging them to communicate. I just try to explain to them, listen, whatever you do, it needs to connect to the person's discomfort that they've come in for.
Mm-hmm.
And even though traditionally, if you look at my intro Thai work, we start at the feet because you open the energy lines through the feet. And I try to give them the sequence while saying, listen, what happens when it gets really good and you break the sequence? And now I communicate with the client and I improvise the session based on my many tools on what I think is going to be best for the client with connection and communication. Of me meditating, breathing, undulating, swaying open my spine, and releasing my own physical tension while I work, not developing carpal tunnel syndrome, which drives me completely insane on massage therapy groups, by the way. Like, I'm like, guys, we've already solved this problem, but you're not, like, you're telling me the answer is not what you want. In other words, we don't really want to change what we do. And I'm like, not only do I think you can get better clinical outcomes and make more income, I think you can also ease your own physical strain. And they're like, that's absurd. What you teach isn't massage. And I go, all right, next.
Yeah. Well, and get tagging along on that too. I think a lot of times when people talk about transitioning to maybe a more neurocentric approach or a pain science approach or some of these other approaches, it's almost like the thought that what they're doing is wrong. What they're doing is less than, what they're doing is a lie. And I think that's the part that needs to really be taken a look at. It's like I still do with my hands what I've done since I learned it in 1992. Yeah. I'm thinking differently. I'm explaining it differently. Is my definition or is my explanation better than that original myofascial release explanation? Well, if you're asking me, it's more plausible. Is it shown to be more accurate? Nobody knows the full answer yet, right? Are you comfortable with uncertainty? I am. I'm really comfortable with the uncertainty. I'm really comfortable not knowing. If you talked to me 15 years ago as a patient, I would have sounded really smart because I would have told you all about the fascia and what was wrong with your fascia and why nobody else in the world has ever been able to find your problem because they don't dance around the fascia like I do, okay? If you talk to me now, I'm going to sound a lot less informed but I'm probably a lot more well-informed because I'm going to let you know that, you know what, some people might think it's this or this or this, but ultimately there's a great deal of uncertainty. Number one, what's wrong with you? And number two, what happens when we treat? All right. I still do those hands-on things, except I include the patient in a very different way than I was taught. Not that in MFR we didn't include a patient, but it was all about staying really quiet so the patient could go deep and process their emotional past and present and figure out all the blah blah blah. And it's like, you know what? I'm a lot of work as a patient. I'm a lot of work because I need a lot of input from you to assure that what we're doing is relevant and useful and not just a bunch of stuff that I think is important.